Welcome and thanks for joining us. My guest today is Rick Bryant. He is the Healthcare Chief Technical Officer at Veritas. Rick, good to have you with us.
Thanks, Tom. Great to be here.
In the pandemic, I mean, you really can't talk about healthcare outside of the ongoing pandemic. Hopefully it's starting to wane, but each week brings a new surprise, it seems. But the move to outcome-based medicine quality reimbursement, this has been a trend now in the government and CMS and the third-party paying system now for several years. How would you say it's been affected by the pandemic, that move toward outcomes-based, quality-based repayment of services?
Well, I think it has put a delay on that. We had major advancements after the Affordable Care Act in terms of being able to move from a fee for service to an outcome-based service. And we started really refining those metrics over time. It started out with very basic things like reduction in readmission rates. Makes sense, right? Reducing hospital-borne infections. But now they've moved to MACRA and they've actually increased the amount of recovery. That being said, the pandemic has put a hold on a lot of those recurring quality metrics and the reimbursements associated with it. The metrics are all around being able to track COVID infections, being able to do contact tracing and things like that, which are very critical. And with Veritas as a data management company, we're a key partner in there, not only to be able to help them manage all those new data sources, but to be able to protect it and make it resilient.
So the pandemically then induced data that they are measuring and being measured against, these metrics tracking, it sounds like, though, that when the pandemic itself recedes, there will be a very good, robust mechanism for handling data for whatever metrics people want to plug in that will be the residue from the pandemic.
Absolutely. Absolutely. We've learned quite a bit with contact tracing and vaccination status and all the databases and systems that have been set up around that. They could be very pivotal in improving specific quality metrics like serving underserved populations, improving outcomes, lowering the cost of healthcare. Most people don't realize that 85 cents on every dollar is paid for by your tax dollars. It's paid for by Health and Human Services. And we also have one of the most expensive healthcare systems in the country. This is widely known, but people don't really know the magnitude of it. When you look at the U.S. healthcare expense, it's 16 to approaching 17% of our gross domestic product. And to put that into perspective, the entire armed forces budget, U.S. Navy, Air Force, Marines, even Space Force, is 4%. It costs America 4 to 5 times more to keep Americans healthy than it does to protect America and the world.
Yes, and so it seems like there has to be some fundamental shift in the way the nation approaches this to be able to get measurable cost, order of magnitude cost out of processes and so forth. But it strikes me that somehow the answers, at least in part, are in the data, aren't they?
Yeah, all the data should hold all the secrets that need to be answered. And, we're starting to see that come about, right? I always tell people, having been in healthcare systems for 28 years, there's a reason we call it practicing medicine. If you got out of med school 30 years ago and I got out 5 years ago, how different do you think the body of knowledge is? And how different do you think our practices are? And it's because of that there's a lot of waste within the system. Now, by capturing the data, they're able to pull together. Let's say you're trying to find the best treatment for a sustainable diabetes treatment. They pull together all the communication with the experts and all the data within the EMR to be able to correlate that in what they call a data lake to come up with the best one treatment practice. It's kind of similar to the McDonald's process, if you will. No matter where you go in the world, you're going to get that same quarter pounder with cheese. And that's what they're trying to do with medicine, to make it cost effective and repeatable.
Yeah, because there is that geographical distribution of unequal healthcare access and quality, and that's a big issue because it gets into the human factor of where people are located, where healthcare providers want to locate, and that gets to the question of telemedicine, which is very active in the Veterans Affairs Department, is really a pioneer in telemedicine, and not necessarily just video. Sometimes a phone call ranks as telemedicine, and now the private sector is starting to follow. What do you see as the future of tele with respect to federal reimbursement and in the federal healthcare system, large as it is?
It's interesting you bring up the VA as an example because one of my wife's best friends is a nurse manager at the VA. And when we were developing our telehealth solution, I was actually working with her, and she was telling me that they were using every method available to be able to get to their patients, whether it's a phone call, whether it's a fax machine, FaceTime on the iPhone, everything to be able. And that was good because they were able to service those patients. Well, during when we declared the national emergency under the Stafford Act, that allowed hospitals to be able to get reimbursed for telehealth services. And honestly, Tom, I got to tell you, I've seen more advancement in telehealth in the past 2 years than I have in the past 10 years. And we've seen huge capabilities in terms of being able to reach people that they couldn't be able to reach before, but to be able to provide continuity of care. Now, even though this is only enabled under the national emergency, the reimbursement component of it, we believe that legislation needs to be put in place to enable this as an ongoing healthcare system. And I can't think of a better way to be able to reduce the costs associated with healthcare. If you don't have to pay for a lot of brick and mortar, and there's things that can be done very simply and easily, telehealth is a great way to do that. So we're looking forward, and we're working with advocacy groups like Chime within healthcare and within the federal government to get that legislation put in place.
And I get the sense that there is a clue in what the military has been doing in different places over the past several years to provide the missing link in some ways for telehealth. And that is person based peripherals that provide data related to vital signs or whatever
Mm.
it might be, imagery that is transmitted back to the healthcare provider, and therefore makes the telehealth experience enriched by having almost a clinical presence on the person, but then
Mhm.
transmitted telephonically to the provider.
Yeah, it's amazing the advancements in those medical IoT devices. I've even seen where they've been able to put in devices woven into a shirt that can constantly manage your blood pressure and your temperature and your heartbeat. All new little rings and things that are coming out to be able to do that. Now, that's both a blessing and a curse for the healthcare system. It's a blessing in that they get all this enriched data and they can have demonstrable compliance to their goals, making sure that medication compliance and blood pressure compliance, all those things are being done. But it also creates a mountain of data. And so they're struggling with how they're not only are they going to leverage it, but how are they going to manage it? And what is the life cycle of that look? But Veritas, as an enterprise data governance company, we can help them with that process. Make sure that they have high availability to the data at the time of need, and then tier it to where it reaches its end of life and defensibly delete it.
And of course, we can't talk about all of this growth in big data and big data analytics without talking about data protection. And federal holders of data, and golly, if you throw in the NIH and the CDC and VA and the military health system and TRICARE, there's a lot of data about individuals and their health held by the federal government. And yet the government is just as susceptible to ransomware, the new
Uh,
danger really across the economy. And so what's your thinking about the best way to make sure that going forward, all that data is sacrosanct?
Well, that's a very interesting topic. It's got to be one of the hottest topics. And actually, I've never been a fan of government overreach, but with the executive order issued by Biden requiring that federal agencies have a zero trust architecture and that they share data between agencies is nothing but a positive thing to me. I was a little bit reticent to find out that they weren't sharing data after 9/11. But at least now with this executive order, they are sharing data. I've also seen an unusual partnership between the federal government and the private sector in combating ransomware. The Keystone attack, for example, you saw the federal government went after and shut down 2 domains, which were command and control traffic. They were also able to recover at least half of the ransom. And I think that that type of proactive work with private sector and the federal government is going to be critical. And it's also going to be critical to make sure that, let's face it, Tom, this ransomware stuff is the new form of warfare. Cyber warfare. They don't want to, why send out missiles and tanks when you can just send out a packet and be able to destroy the infrastructure? And I've seen, especially in the federal government, where ransomware, which is typically motivated by revenue, right? It's a money business, has evolved into what they call killware. And what that does is that's designed specifically to shut down critical infrastructure. There was one water system where they tried to hack in and they tried to increase the level of chlorine in the system to fatal levels. and then we were able to stop that. But this type of approach of collaborating, zero trust architecture, and then making sure that you can recover and recover at scale is going to be critical moving forward.
And just to end on a positive note, though, it's fair to say that the pandemic, bad as it's been, has kind of forced a rethinking of infrastructure, rethinking of approaches to data, that when the pandemic recedes, we'll be in good shape in terms of the healthcare sector to advance in terms of ultimate outcomes for people that need healthcare.
I absolutely do believe that. I think that the pandemic has tested us to the limits of our system and forced us to evolve. And we've become much more dynamic, both in the federal payer system and being able to respond. I was very proud of the government for setting up that CARES Act to get early access to the resources needed to fight the pandemic. And the structure that we're putting in place and the resiliency and the agility is hopefully going to be here to stay.
Rick Bryant is the Healthcare Chief Technical Officer at Veritas. Thanks so much for joining us.
Thank you, Tom. It's a pleasure.
And I'm Tom Temin. You're listening to Federal News Network. For more on this discussion, please visit federalnewsnetwork.com and search Veritas.